usually we take the view that when we receive small numbers of anecdotal examples of problems in the health service, we investigate them because clearly we want to come out with a responsible statement which reflects the problems on the ground. But we have seen an increase in the volume more recently of complaints in relation to the dial-in number and the access to the service. Together with a number of complaints where we've been phoned in from constituents to the office and emails sent to our general information account, which sets out more of the problems in details. And look, to do this and the efficacy of the telephone system, I myself tested it to see how I could access an individual appointment. Hopefully at the moment I'm quite healthy, so I wanted to test how achievable it was. After pressing 111, no appointments available. Tried it again following day, no appointments available. So there clearly is a problem with the technology. And the wider problem, of course, is the restoration of the health service, which is where the meat of this press release is, because we want to see, and people are crying out for, those in-person consultation with doctors, those regular blood tests, child visits to dentists. We need to start restoring those primary health areas so that people can have that confidence that we're seeing doctors, because ultimately it comes down to this. Once you don't have that lack of physical connectivity with your medical practitioner, you lose some of that diagnostic ability and treatment that follows on from that, and the delays that are involved in all of that. So we're quite concerned now that the delays to diagnosis and treatment will have an effect on the health of people reporting illness and I hope, God forbid, serious illness.
The GHA stood down from that Majax posture a few weeks ago, but we're not over the pandemic yet. We do have GHA staff tied with COVID swabs and also the vaccination program, which is entering its final phase. Could it be perhaps that GHA staff is still committed to elements of dealing with the COVID pandemic?
Undoubtedly, COVID has presented very significant problems across the health service, and our health warriors have been there at every turn to assist with the vaccination program and the swabbing, and they should be absolutely commended, and there'll be an appropriate time in the future where we do that publicly for them. But I think what we need to acknowledge is that there needs to be significant resource into this area whereby we can say to people, have the confidence in our medical services, because I am really worried that if we start missing people's health in terms of the diagnosis and the treatment, what is the effect that that can have on the lives of people? And particularly children as well, who just need to see the doctor. Children haven't seen the dentist for a year and a half. And, we really need to start ramping that up and improving the access to medical services at primary level, because that's what's important to people on the ground. We're not over it, as you say. If it's a difficult period of time, we need to be cautious. We have a neighbour which is oscillating between levels of and new variants of this disease, and we have to be cautious, no doubt. But we need to restore our primary health services as quickly as possible.